It really is such a privilege to be able to join you to discuss National Heart Health Month and the importance of cardiovascular health for women. Today we recognize the important work of the Mount Sinai Heart Institute, one of Florida's leading heart programs focusing on prevention, detection, and treatment of cardiac disease. Your work is critical in saving many lives in our families and our community, and your devotion to the highest quality care for patients is vital to the battle against heart disease. And I have seen it firsthand when I have toured through the center and spoken with your experts and used you as a valuable resource. Since 1963, our nation has commemorated National Heart Health Month with an annual presidential proclamation. I'm so glad that we're here together this February to talk about the importance of heart health awareness, especially for women. It's really fitting, right before Valentine's Day, tomorrow, with heart-shaped reminders all around us, that we remember to think about how important our hearts are for our body's health. Sometimes we take our hearts for granted. Although it's too often thought of as a man's disease, heart disease is actually the leading cause of death for women in the United States, and around the same number of women and men die each year from heart disease in our country, and most people don't realize that. Especially most women don't realize that. Despite the fact that about 1 in 4 deaths in the United States are due to heart disease, a large percentage of women don't perceive themselves to be at risk. But the reality is heart disease is extremely prevalent, and it cuts across racial and ethnic lines. It's the leading cause of death for African American women, American Indian women, Hispanic women, and white women. For Asian American women, heart disease is second only to cancer. For this reason, in 2003, then Secretary of Health and Human Services Tommy Thompson proclaimed the third Friday in February as National Women's Heart Day. It is vital that we take this opportunity during National Heart Health Month and National Women's Heart Day to help women understand their risks and take charge of their health. And that's incredibly important, something I've been an advocate for a number of years now, taking charge of your health and knowing your risk, and arming yourself with information and the knowledge that you need to remain healthy and prevent illness down the road is absolutely critical. Because the statistics really are sobering. Between 6 and 9% of all American women are currently living with coronary heart disease. And almost 2/3 of the women who die suddenly of coronary heart disease had no previous symptoms. That's why all women need to know the early warning signs of heart disease, and they can be different than the early warning signs for men. And they need to be aware of their own personal risk factors. Despite the perception that heart disease is only something men or older women need to worry about, we should know that even young women can be at risk. That's why I'm proud to be a co-sponsor of the Heart Disease Education, Analysis, Research, and Treatment for Women Act, the Heart for Women Act. This bill will improve the prevention, diagnosis, and treatment of heart disease and stroke in women. Personally, as a breast cancer survivor, it became undeniably clear to me women facing any chronic disease need and deserve all of the available information out there that can help save our lives. We can never ever say it enough. Every woman, especially every young woman, must take charge of her health, must not think that she is invincible, and she must do what's right for her. And if we say it loud enough and often enough, there's no telling how many women will be able to help. So we are so fortunate today to have several speakers who can demonstrate just how vital heart health awareness can be for women and for all Americans. Let me just make sure that it's the same people that I expected this video. Okay, good. We have with us Dr. Tony Lamas, Chairman of Medicine and Chief of the Columbia University Division of Cardiology here at Mount Sinai Medical Center. Dr. Judith Anton, okay, yep, just still making sure, a heart champion with Women Heart, the National Coalition of Women with Heart Disease, who had her first silent heart attack at 57, and Elizabeth Cooper, a young mother who has been dealing with congenital heart disease for her entire life. I'm also thrilled today that we're joined by Conchita Ruiz from the American Heart Association. I'm so proud to welcome them here this morning and to serve as an informal MC, so let me turn the podium over to Dr. Lamas. Dr. Lamas, thank you.
Thank you very much, Congresswoman. Just to supplement some of these incredible statistics, 435,000 women, American women, will have heart attacks this year. 83,000 are under the age of 65 with an average age of about 70. Twice as many women who have a heart attack are likely to die within the first year compared to men. So twice as many. Under the age of 50, women's heart attacks are twice as likely as men's to be fatal. So, that brings up a couple of items. First thing is for physicians and women, because you have to have a hand in your health, but for physicians and women to keep in mind that a woman is not just a man in a skirt. Women are physiologically different. They present differently, they have different outcomes. So, again, if a woman is having symptoms of a heart attack, 71% of women who are having the earliest symptoms of a heart attack are not having chest pain. They're having tremendous fatigue, weakness. It feels like the flu. I've taken care of a number of women who really just don't have chest pain, but have something other. They'll have abdominal pain. They have back pain. They're sweaty. They just feel ill. And if the physicians are not aware of this, and if the woman is not aware of the atypical presentation of heart attacks and of coronary disease, then we miss the boat. You remember I was speaking with you earlier regarding how important it is to get those arteries opened early. Well, sometimes it's very hard to interpret the symptoms as heart attack symptoms and put together the team to get that artery opened. But at the end of it all, from my perspective, I would rather see any of you women as a preventive visit rather than in the emergency room. So what can you do to prevent heart disease? And that's really what's key. How do you prevent heart disease? Well, the first one is, of course, do not smoke. A woman who smokes and has a heart attack has that heart attack 20 years earlier than a woman who does not smoke. So for the secret smokers in the audience, because they're all secret smokers in the audience, for the secret smokers, take 20 years of age off of your calendar. Just stop smoking. Blood pressure has to be controlled. A hypertensive woman has a 3.5 higher incidence of having a heart attack than a non-hypertensive woman. Your target is 120/80 and keep that in mind. Cholesterol has to be controlled. You can't control cholesterol unless you go to the doctor and have him measure it, or her measure it. So measure it and make sure that it's under control, and take your medicine if you need to have it be under control. Lose weight, exercise. There's really no gimmicks to losing weight. You have to diet and exercise. Take the time away from your family so you can diet and exercise. Because at the end of it all, the worst thing for your family is for you to have a heart attack. That's the worst. It's the worst thing for your business. So at the end of it, so you really have to focus on what's the most important item. And the most important item is your health. Eat healthy. Don't eat fast foods. And remember, we really are here for you at the Mount Sinai Heart Institute. We're Florida's leading heart program. But I would much prefer to see you in my office to prevent an event rather than treating an event and running to keep you from having something bad happen to you. So at this point, I'd like to introduce our next speaker. She's been an advocate in the fight against heart disease in women for many years. And I'd like all of you to welcome Conchita Ruiz, corporate sponsor from the American Heart Association.
Thank you, Dr. Lamas. Yes, hi, good morning. I'm here very proud to be representing the American Heart Association. Actually, I'm with AvMed Health Plans, and AvMed is the local corporate sponsor of the Go Red for Women campaign. It's a very important campaign, a very interactive and creative way to raise awareness about women and heart disease. So this is a great event for us this morning. In 2004, the American Heart Association faced a challenge because they saw that 500,000 women were dying of heart disease, yet women were not paying attention. In fact, many of them were dismissing it, saying that it's an older man's disease. And I think women, the disease presents differently with women, which Dr. Lamas mentioned, but we also have an issue, the women among us, that we tend to put everyone else first before us. So it's the last thing we worry about, and that's, I think, the symptoms are dismissed by the patient themselves. So the Go Red for Women is an exciting campaign to raise awareness, raise funds, and really get people engaged to learn how to prevent heart disease, how to live healthier lives. And February, I don't know if Mount Sinai, I know at AvMed it's a big deal. Did you all celebrate Go Red Day on February 3rd? Yes. So we did too. It's a way to build awareness, and we really do have to put ourselves first. I know that's not our natural instinct, but we do. The statistics that Dr. Lamas shared with you speak for themselves, and I won't go into any more detail. I'm going to now introduce someone who, Dr. Anton, who is a retired school teacher here in Miami, who is involved with the National Coalition of Women in Heart Disease, and she'll explain to you why she thinks this is very important.
Good morning. I'm a heart survivor, and I'm a women's heart champion. And I would like to introduce the coordinators who are here with us today, who are responsible for bringing the little red bags of women heart information. Annie De La Vesca, I'm sorry, and Andy Wiener. And they are representing Women Heart also. And I came prepared to discuss every single thing that has been discussed. But I have one step out in that I am a heart survivor. All the statistics you heard, all the facts that Dr. Lamas talked about, women ignoring the heart symptoms, I will tell you are very true because I'm a survivor. Part of my heart is dead, and I have survived to tell the story. And I had a silent heart attack, and 70% of the women who have that attack die. So I am so very fortunate to be standing here before you. And I feel it is my responsibility to share this information with other women, especially through our organization. I give volunteer talks to small groups all over. And it's amazing the stories I hear from women. I did not know about heart disease. It was in my family. My father had a heart attack at 54, but I did not know anything about heart disease. I had been told from the earliest time I can remember, lose weight. Yes. And I couldn't understand really why, because no one told me why. I then became diabetic at 42. And I did not know that if you're diabetic, you might as well say you're going to have a heart attack, because it is that closely related. And I took care of myself, but I still didn't lose the weight. I exercised off and on, that's what we do. And it's a long haul. I am now 67, and I am healthy. I still have all the same things wrong with me, but I work at it. I work at keeping myself healthy. And I had symptoms that I didn't know about. They even took my gallbladder out because I had a pain in my back. 10 months later, I was on the operating table having bypass surgery. And so the symptoms that present to women are not the same as for men. I did not have symptoms as such. I went for my stress test after I had had one test with my family doctor. He sent me to the cardiologist, and I got halfway through the stress test, and the doctor said, "You need to get off the treadmill. You need to sit down. You have had a heart attack, and you have blockages." And within 2 weeks, I was operated on by your Dr. Lamellas. And he put a zipper in, okay? He said he couldn't put the zipper in, but I have the mark if I need it. So I hope I never need it. I'm working hard to keep healthy, and I'm working hard to spread the information. My daughter is 40, and she knows every fact that can possibly be at this point. And she was with me when I did have my heart surgery, so she's been there, knows that, and that is information for all young women. Because when you get to 55, 56, which is what I was, it's a little bit late. But I have lost weight, I am working out, I am eating right. And I know my numbers. And ladies, you need to know your numbers. Make sure that your doctor is doing the job, because I can tell you, I went to doctors that did not recognize my symptoms at all until I was in their face saying, you know, there's something wrong here. I have a little hesitation, and the room starts to close in. And the doctor says, oh, I don't like the sound of that. And that started the whole thing. An astute doctor, but a little late. So I encourage you, you can join the National Coalition of Women Heart. If you have heart disease, have it in your family. If you're just truly interested, we have a website, and you can get so much information from there. Thank you very much. I would like to introduce another heart survivor, Elizabeth Cooper.
Good morning, everyone. My name is Elizabeth Cooper, and I'm a heart disease survivor. I was born with a congenital heart defect known as aortic stenosis. I have undergone 4 open heart surgeries since birth. Most recently, my heart valve was replaced, and an automatic pacemaker defibrillator was implanted here at Mount Sinai by Dr. Lamellas and his wonderful team. I am living proof that heart disease does not discriminate. It can affect anyone, at any place, any time, or any age. It's very important for everyone, especially women, to recognize the signs and symptoms of heart disease and act quickly. A couple of months before my most recent surgery, I started feeling very tired, fatigued when exercising. I knew right away that it was time to change my heart valve again. I knew within a couple of months after my surgery, I felt like myself again, and I was back on living my active lifestyle. Everyone should eat healthy and keep very active. It is the key to a healthy heart. I'm sorry. Last but not least, I want to thank God and the doctors at Mount Sinai and all the professionals that with their medical expertise and compassionate care saved my life and gave me the opportunity again to continue living my extraordinary life with my 2 children and my wonderful husband. Believe and have faith. Thank you.
So if there are any questions, we can do it now or afterwards, but I do want to just wrap up by emphasizing one other point that has not been mentioned. Years ago, federal research dollars only went towards studying heart disease in men. And women were not the subjects of federal research at NIH or any of the federal funding that went into the research of how to treat heart disease. When the women members of Congress realized that, there was outrage. And because, as Dr. Lamellas said, women are not just men in a skirt. And as you've heard this morning, the symptoms can be different, or women can be asymptomatic. In fact, I remember throughout my life, and I'm sure for everyone here as well, even the educational outreach information, the information that was so prevalent through PSAs and information distributed on letting people know what the warning signs of a heart attack were oriented towards the warning signs for men. The pain down the left arm, the tightness in the chest. Not that those things aren't symptoms for women either, but very often they are not symptoms for women. And so continuing the effort, and that's what the women's heart legislation is designed to do, to make sure that we continue to infuse research dollars and actually have the research projects done on women as such.